all the different aspects of the COVID-19 epidemic that is outbreaking across the country. As we know, this continues to be an incredibly rapidly evolving situation, which is making some of the decisions that we make very challenging, very tough, but we're using all the data and information that we have available to make those tough decisions and ensure that we're getting the services and the opportunity out to the citizens here in New Hampshire. I'm going to begin by just asking Dr. Benjamin Chan, who a lot of you know, to come up and just give us a brief update on some of the more key aspects dealing with this outbreak. Dr. Chan?
Great. Good afternoon. Thank you, Governor. So I want to start by giving all of you just a brief update on some numbers. Our public health laboratories to date have tested over 1,400 individuals for COVID-19, and we have identified now 44 individuals, residents of New Hampshire, who have been diagnosed with COVID-19. These are individuals throughout multiple counties in the state. And our public health laboratory continues to do testing as a service to providers throughout the state. Our public health lab currently has over 800 tests pending. So what you've seen over the last week is that we've certainly attempted to ramp up testing to identify infections in New Hampshire and identify risk factors associated with these infections. The majority of people who have been diagnosed with COVID-19 in New Hampshire continue to have travel, either domestic or international travel, as the primary risk factor for acquiring COVID-19. As we've seen from the rapidly expanding pandemic around the globe and within the United States, there is risk to acquiring and being exposed to COVID-19 through travel. We have also announced in the last couple of days that there are several communities throughout New Hampshire where we have identified COVID-19 in individuals who do not have any identified risk factors. That is, they have no identified travel and are not known contacts of someone with COVID-19. And that obviously raises the concern that there is some amount of community-based transmission that is currently occurring in a number of counties throughout the state. I do want to stress, however, that we have done quite extensive testing over the last week throughout the state, and a pretty low percentage of those tests have come back with COVID-19. We continue to do our public health investigations and to diagnose people with COVID-19 so that we can rapidly identify people that may have been exposed, to get them under quarantine so that if they do develop symptoms, they are not within the community and posing a risk to individuals. I want to mention again, as I've said in the past, that as this virus spreads around the United States and certainly within New Hampshire, we can expect additional detections of COVID-19 within the state. We have expected to see some amount of community transmission, and we will do our best to try and slow and limit the spread, namely to prevent a large spike or increase in cases, which would put a huge burden and strain on our healthcare system. We want to try and slow the spread of this virus within New Hampshire, as others are doing around the country, to, as we say, flatten the curve, which can help prevent burden on our healthcare system and help decrease the number of cases. It is critically important, and I want to stress this again, for people to stay home if they are sick. We know that the novel coronavirus that causes COVID-19 is a very infectious virus. It can spread very easily person to person, and it can spread very easily even early on when people may only have very mild symptoms. Right? So not everybody with COVID-19 will have a fever, for example. Or if they do have a fever, that fever may be delayed by several days after onset of more mild symptoms. Not everybody will have severe respiratory illness as a symptom. Many people that we have seen in New Hampshire have started their illness with mild symptoms such as feeling fatigue and headaches and muscle aches, maybe some chills without documented fever. We know that the virus is infectious at these very early stages of illness, and so it's critically important for anybody that is feeling sick with any of these symptoms to stay at home and limit contact with others. This is especially important to protect our more vulnerable populations in New Hampshire, right? We know that the majority of people who have COVID-19, 80% or more of people who come down with COVID-19 will have more mild illness. They won't need to be seen by a provider, they won't need hospitalization, but these individuals are still at risk of transmitting it to others in our community who may not have as good of outcomes. We know that people who are 60 years of age and older and people with multiple chronic health problems are at increased risk of hospitalization, and potentially even life-threatening illness. And so it's our collective responsibility to protect our family, our friends, our communities, to prevent this virus from spreading further. I want to make a few comments here about testing. There's been a lot of attention both nationally and locally around testing. As I've mentioned, our public health laboratory in New Hampshire has ramped up testing to the extent of our ability. We also know that various reference labs and potentially some hospital labs are also bringing on or have brought on the COVID-19 testing. So the actual test capacity has dramatically increased over the last couple of weeks. However, as you, I'm sure, have heard nationally, the limitations that you've heard about nationally in the testing process are also present in New Hampshire, which has strained our testing capacity given the increasing demand. We are working with our hospitals and healthcare systems to be able to maintain testing within our state, but there will come a point, and that even now, there is a need to potentially prioritize testing for those who are more seriously ill, for example, people who are hospitalized, and those who are at risk of spreading it further within our communities. So I'm thinking healthcare workers, people working within long-term care facilities, and others who work with larger populations of individuals. These are the individuals that are important to test if they develop symptoms to prevent and minimize further transmission in our communities. We understand that there are a number of people, in fact, potentially many people in our communities who have looked for testing and have had a difficult time obtaining the test. This largely is due not to a limitation in test kits, but to a limitation of other supplies and equipment in the process and chain of testing before a sample even gets to a laboratory. So regardless of whether someone gets a test for COVID-19 or not, it's important, I want to emphasize again, for everybody to be taking steps and precautions against transmitting this new coronavirus. So individuals who may have symptoms of COVID-19 but potentially are not tested, and those with diagnosed COVID-19, we are asking that they remain home, whether tested or not. If someone has symptoms consistent with COVID-19, they should remain home for a set period of time, as is described in some newly released guidance from the U.S. Centers for Disease Control and Prevention this week. Namely, I would ask you to remember the numbers of 7 days and 72 hours. Right? So someone who is diagnosed with COVID-19 or someone who has symptoms consistent with COVID-19 but perhaps hasn't been tested, we ask these individuals to stay home for at least 7 days from the time their symptoms began and at least 72 hours after their symptoms have resolved or improved. That is, at least 72 hours after fever has gone away off fever-reducing medications if a person has fever and other symptoms, respiratory symptoms, have improved. So this is a potential change in what we're asking people to do if they have symptoms that are consistent with COVID-19, even if they haven't been tested. We will continue to work with our state agencies and our local healthcare partners and providers to try and make testing available to the best of our ability. But as of right now, there continue to be, both in New Hampshire and nationally, some limitations with our ability to be able to provide this test to anybody that may be symptomatic and is looking for the test. Again, I want to stress that this is a rapidly changing and a rapidly evolving situation. It takes team effort, both here at the state and in our local communities, and it really is a collective effort on our part to protect those around us who are more vulnerable. So please, if you're having symptoms, whether though that's fever or respiratory illness or potentially mild flu-like illness such as fatigue and headache and muscle aches, please remain home and help prevent further spread of COVID-19 in our communities. And as always, when we have further information and further updates, we will let you all know. Thank you very much, and I'm going to turn it back over to the Governor.
Great. Well, thank you, Dr. Chan. I want to touch a little bit upon the unemployment insurance benefit package that we announced just a couple days ago. It's a huge opportunity. We understand that some of the decisions we made in the small business community are going to have a real effect on individuals when we're talking about employment and their ability to everything from pay rent and take care of their families. We talked about the ability to ban essentially foreclosures in this state temporarily through the state of emergency, to make sure no one can be evicted, to make sure no one's utilities are shut off. These are all very positive steps. There's been a very strong run into the unemployment insurance system, as folks can imagine. Again, we encourage people to, if they have questions, to pick up the phone and call 271-7700. You can go online to apply for those benefits. There's a big run on that system, and again, we ask people just to be patient as they go through that process. We're trying to make it as simple as possible. Another area we're moving forward with small businesses, knowing that they all are going to have to make some sacrifices, that these are challenging times, and that we are probably in this for the long haul, is to be able to provide some economic relief for these businesses, for their employees. Just yesterday, we saw, just taking a step back, just yesterday we saw the Trump administration sign the bill that will allow unemployment insurance to be backfilled. So I know there's going to be some questions there in terms of allowing our unemployment insurance pool to be solvent while we go through this unprecedented level of drawdown on it. But also for the small businesses themselves, we were one of the first states in the country to apply for and receive our Small Business Association Economic Injury Disaster opportunities here in the state. Commissioner Taylor Caswell from the Department of Business and Economic Affairs moved forward. Him and his team moved forward very quickly on that front, which allows New Hampshire to really be on the forefront of the financial opportunity that the federal government is providing with that second tranche package, which has been passed. So I'm going to ask Commissioner Caswell to come up and talk a little bit about the SBA opportunities.
Thank you, Governor. So we are here at the Department of Business and Economic Affairs really starting to move aggressively on a number of fronts, not the least of which has been over the last week. We've worked very hard to put together the necessary components to allow the governor to request a disaster declaration from the Small Business Administration. What that does, once we have achieved that, which we did last night, is the ability to access economic development injury loans for small businesses, to be able to get access to working capital as necessary, and to be able to carry those forward in terms that hopefully will make some sense financially for those businesses. Specifically, it does provide working capital to help businesses with costs like fixed debt, payroll, and accounts payable. Loans are up to $2 million and are available currently at a 3.75% rate with repayment terms of up to 30 years. People can apply for that now at the SBA's website at sba.gov/disaster. And we can also reach that through the business portal, which is the second part of what I wanted to raise today for everybody, which is that we have just launched a new business portal under our department website, again, to provide that early stage information for businesses. One stop on what's going on, what are the resources that are available on the federal side and on the state side, and that is a list that we hope that's going to continue to grow over the next couple of weeks or days. Things that we have available on that website currently are information on business-related state government updates, such as the executive orders the governor has issued, access to our regional team of business support specialists. People will be able to get local assistance through our office. All of that information is available on the site. We have, as I mentioned, links to the SBA disaster site for people and businesses that want to apply for those loans, or at least examine those loans and see what opportunities are there. And we have important resources. I would also emphasize for businesses that are looking at or potentially going to have layoff situations. We do have a rapid response team at the department that is a multi-agency team to help employers and employees weather the storm with layoffs. That information is on the website. And of course, we have links to other state and federal resources that are available. The portal itself right now is in its very early stage. We would, I think in many cases, want to have it look a lot better and have it be a lot more content heavy. But at this point, we feel it's very necessary for the business community to be able to access this information. And so we are going to grow this website and grow our ability to communicate with the New Hampshire small businesses on a timely basis as we go forward. So you'll start to see some of that roll out next week. The last thing I'll mention is that we are also, with the governor, meeting regularly with business leaders and with businesses around the state. In fact, we have a call tomorrow with chamber executives and the Business and Industry Association to talk about the things we're raising here, but also to continue that level of communication, which is actually part of, in our view, a critical part of being able to help our businesses weather this storm, use the strong economy that we have right now in the state of New Hampshire to hopefully have whatever downturn is coming have a minimal impact as possible when we do get through this crisis. So thank you. The governor and his team were working very closely with everybody from HHS to Employment Security to make all of these pieces go together in a very effective way to help the businesses in the state of New Hampshire. Thank you.
Thank you, Taylor. Today we're also here to announce some new initiatives that help ensure that individuals can definitely still get the health care they need and all doors will remain open. We know that our healthcare system, our hospitals, they too are making some very tough decisions by foregoing their elective surgeries and other procedures, which usually are used to help cover their bottom line. These choices are tough, and they're doing so to help the state respond to the COVID-19 crisis. So today we're taking these additional steps to ensure healthcare systems in New Hampshire can continue to provide critical response care to those with COVID-19. Today, the state is establishing a $50 million fund to help ensure our health system remains nimble and responsive. These funds will be available to hospitals and others who need resources through no-interest, short-term loans. The Department of Health and Human Services will develop a simple standard application form, designate a contact where all these applications can be filed for healthcare providers. As well, we'll be opening up longer-term loan guarantee opportunities through the Business Finance Authority to help healthcare facilities across the state ensure the continuation of services for our citizens throughout the remainder of the crisis, knowing that this, again, could be a long road ahead. We have to support the entire system, top down, so that individuals can receive the best care possible from the ground up. We must ensure our system has solvency and cash flow and will not let the doors of help be shut to anyone. I guess now we can open up to questions.
I want to ask about the cases so far. So I could be mistaken, but I don't think that the state has been releasing ages for any of the cases, positive cases that come in, nor other risk factors they may have had. I'm wondering if you might start doing that because there has been, I think, some misunderstanding over what age population it affects, and it does affect more young people than was previously thought.
Yeah, thank you for that question, and that's something I can certainly talk with my team about. I don't know those numbers. Typically, when we release demographic information, oftentimes it's at the adult versus pediatric level, but we can go back and reevaluate to see what we can release. In terms of your comment of who it affects, a source of transmission within our community. Hence my earlier comments about everybody, kids, young adults, older adults who have symptoms, even potentially mild symptoms, need to stay home when sick and when ill. Thanks.
And the second part of that, we've now had, I think it's been a few weeks since the first case was announced.
Mm-hmm.
Is there any plan to have some sort of dashboard or some sort of way to track how these cases are proceeding so that people can know what the recovery rate is?
Yeah, so good question. We do update the numbers and county of location where people live who are diagnosed with COVID-19. That's currently available on our website, so people can go and look at the numbers, the testing numbers, the people who test positive, and their location within the state. We haven't provided any information about who has recovered. What I can say is that most people that we have diagnosed with COVID-19 in the state have only required home isolation. I think there were 2 individuals we announced yesterday who had required hospitalization but were in stable condition. And in fact, I can also probably announce that there's 2 individuals who are now in the process of coming off home isolation because their symptoms have resolved, and we're using some of that new CDC guidance that came out this week to determine who can come off home isolation, who can be allowed back in the public once their symptoms go away. Thanks.
Dr. Shane, can you just describe the process for the rationing of the tests? Who makes the decision ultimately about what tests get used when and where?
Yeah, so the Public Health Department is no longer in the position of determining who gets tested. We have put guidance out through our Health Alert Network message system to providers to ask them to help prioritize which patients are higher priority to get tested. But we in our public health laboratory are not screening which individuals are, of a certain demographic and should be tested. That we're leaving that to the providers to ask and asking them to help assist with identifying who needs to be tested. It's very hard from a public health level to be making individual decisions on a patient by patient basis, and so we need our healthcare providers to help in that regard.
Dr. Chin, since there is a rationing of this test, is it safe to say the incidence of COVID-19 is greater than has been reported right now? And is there any thought to projecting going forward how many cases New Hampshire could occur given the growth we've seen in the last week?
Yeah, I think that's a good question, and one that we've been getting frequently. I guess I would point you currently to the numbers. We've tested over 1,400 individuals. We have another 800 tests pending in our public health laboratory. So we've certainly very dramatically ramped up testing, and so far today we've only identified 44 individuals. It's a relatively small percentage, like approximately 3% of the people that we've tested have come back positive. So we don't believe, based on those numbers, that this is a virus that has been circulating in our community, for example, for weeks. If that was the case, we would be seeing much higher numbers with testing, knowing how easily this virus spreads person to person in our community. There has been a lot of interest around sort of doing projections and what can we expect to see. And I think that's a difficult question to answer. We're currently trying to assess that for planning, what we call surge planning for our healthcare systems. But it's, we certainly don't want to be in a position like we saw early on in China or what we've seen in Italy, where you see exponential growth in the number of cases. You see a huge spike in cases, and that's largely the purpose of a lot of the measures that have been put into place to date in New Hampshire. The reason that we do our public health investigation is to identify, close contacts of people with COVID-19, so we can get them under quarantine, out of the public space. The reason for limiting gathering sizes and cancellation of schools. All those measures are meant to try and blunt the impact and prevent that exponential rise in cases that we have seen in other countries, especially early on. I would not say we're not seeing that yet, and we hope to try and mitigate or limit that spike in cases, and that's the purpose of what we oftentimes say is flattening the curve. So we won't see that huge spike in cases, so we won't have a huge burden on our healthcare system, and we can better manage those in our community who are identified over a longer period of time. Obviously, this is an ongoing effort. We're very aware of the strain that this can and likely will put on our healthcare systems, and so we're going to work very closely with them to try and get them the resources that they need.
I think, Dr. Chen, you mentioned earlier, talking about the materials, not so much the tests that are becoming a problem, but the actual materials to gather the samples, and that's becoming an issue for the healthcare providers that are sending these samples to the private labs. Is there a state plan to help out these providers get those specific tools to collect those samples to use the private lab system?
Yeah, I think that's a good question, and I think it's maybe worthwhile just briefly mentioning the different steps in the testing process, right? So for a person to be tested, one, they need to be symptomatic, right? We're not recommending testing people who are asymptomatic or without symptoms. So they need to be symptomatic. We ask them to call ahead to their healthcare provider if they're concerned about COVID-19, and then we have to get them to a place where they're able to safely have samples collected. And that sample collection has to be done by a provider under appropriate personal protective equipment, or PPE. And the recommendation for that is, gown, gloves, eye protection, and some type of mask. So what we're seeing is that there's a limitation, and in terms of the personal protective equipment, many healthcare systems are running short of the normal supply of PPE that they have. There are special nose swabs that are required to collect the specimen. We're hearing national shortages of those from across the country, including in New Hampshire. Those swabs that are collected on a patient then get sent to the lab, where they get processed with different reagents, what we call extraction kits, to remove the genetic material, the virus, if it's there, from the swab before it can be tested on the test kits. And we're also having a critical shortage of the extraction agents that are needed to process those swabs. So the limitation is no longer the test kits. There's been a lot of talk about, well, do we have enough test kits? The limitation really is further upstream in that process, the limitations in the personal protective equipment, limitations in the, lacking supply, the supply of swabs, and the reagents and the special kits that are needed to extract the viral RNA from the specimens. So, we have a group within the Department of Health that is working to try and order and obtain a certain supply of these PPE and swabs and different reagents. And when we get them, we are making them available. But this is a national limitation, and so this is something that states across the country are struggling to obtain these resources. But we do have a group within the Department of Health and Human Services and state government that's working on that issue.
If I could, I'm also going to add a little bit there. So we also received new flexibility from the FDA, which will hopefully allow us to, on the swabbing side, use some different materials within the swabs, which, whether it's the actual medium that the swabs are being used to collect. There's a lot of flexibility there that we're really trying to explore to see if that, again, gives us the ability to work with some private sector suppliers, not just rely on the federal government in terms of sending swabs, but work more in the private sector to develop our own swabs as well.
Governor, can you take us through the work that's being done to keep the employment security website up since it gets so much volume?
Sure. The unemployment insurance website is receiving 3 times more volume than it has ever received in its history, and that includes through the recession. The last recession around 2008, 2009. So our IT systems and staff have been working around the clock, bringing in a lot of our private providers and consultants to simply upgrade the level and ability to accept more of that information through the broadband pipe, so to say. We are asking folks to look on the website if they want to apply. I think based on your last name, it's asking you to come back at a certain time just to kind of parcel out and more evenly distribute the demand on the system at any given time. But we're constantly upgrading it. They've been working literally around the clock since it went up. We want to make sure that we have flexibility. If folks have questions or concerns, again, feel free to call. We do have our resource center available for folks looking for information for unemployment benefits. And you can start the unemployment process online, over the phone.
So is there anything more you can share about the call you just had with the President and Vice President?
Well, it was a long call. A variety of different issues were discussed. A lot of governors got to ask some questions. I think, my questions really revolved around supply chain, what we're talking about today in terms of the swabs, the materials, the flexibility from the FDA that hopefully we can have in terms of developing our own swabs and capability to keep the testing going and seeing where it needs to be. Also the financial relief for individuals and businesses. I think both Gina Raimondo and a few other governors talked about the need for the next 3rd and 4th and 5th tranche of potential financial relief from the federal government, not just for states, but for small businesses, for individuals. So I was on the phone with Senator Hassan this morning. I was on the phone with her late last night talking about a variety of issues. Again, I think our congressional delegation is doing a very good job listening to what the needs are here in the state and advocating to get some of those provisions into the next round of federal funding.
What's the rate on the loans for the small businesses?
3.75? I think 3.75 up to $2 million.
But when the Fed is loading at 0, is there a sense that could go down, that there could be even more relief, I guess?
I think our hope is that there will be some flexibility. For example, what we're doing in the state for hospitals on an immediate side with the $50 million fund is essentially providing no interest, very short-term loans to bridge any financing that they may need so they can have time to work with their banks. So whether you're on the healthcare side or the small business side, we're always going to be pushing for more and more efforts. This first $50 billion tranche of small business, the SBA loans that are coming out, which is a great assistance to us, but we don't think it's going to be the last or final say on the federal government's assistance to small business and employees across the country.
On hospital beds, so there's a Harvard study this week that looked at hospital preparedness for if the virus escalates the way it has in other countries, and found that most hospital systems, including New Hampshire's, would need to expand their bed capacity by a lot. what is the plan? You talked about a little bit of this before. What's the plan in New Hampshire, and are you getting any federal funding for that?
Yes and yes. So we're developing, we've been developing a plan for the potential surge onto the healthcare system. Right now, we're in an okay place, but we are always preparing for tomorrow, both in the short and long term. Most of the hospitals and healthcare providers that do currently have beds are looking where they would potentially set up additional beds, who they would contract with that already currently have additional beds. Looking at everything from our ventilators on the private sector. We have approximately 1,000 ventilators out there on the private side. That's a very positive number, but really looking at making sure that if we need more, which we are asking for more, and we're trying to purchase as many as we possibly can, as is everybody, frankly, that we, again, have that ability. But all across the state, we are putting together our surge planning for hospitals, working with the various organizations that can partner with us to provide some of that bed relief.
And then for those who are in the hospital for other reasons other than the virus, is there a plan in place into how to triage them and move them out of beds?
Exactly. That's exactly what goes into a lot of this planning. Each hospital and healthcare provider might be a little bit different in terms of who they would move and where. So if you're in for something completely unrelated to COVID, it's possible they take that population and move it into the surge area, an ancillary area where there's beds. It could be that they treat the COVID patients in that area depending on their flexibility and capability. So we're letting the hospitals really design their own plans, but then we're coordinating all of that at the state level to make sure that we're going to have the capacity if and when the surge comes.
Are there any opportunities for businesses that are in the manufacturing sector in New Hampshire to shift operations to benefit?
Well, I can tell you I was on the phone with various manufacturers this morning, looking at both what they use in their manufacturing process and how it could be reallocated and to help us here with what our needs might be, not just on PPE, supplies, testing, whatever it might be. We're really looking at breaking down all the different pieces of that puzzle and then going out to our local providers. And I got to tell you, businesses across the state are really looking to stand up to help and do what they need to do. I think everyone understands that it's an all-hands-on-deck effort.
Governor, the governors of Massachusetts and Vermont have moved to close most daycare centers and prioritize the ones that are remaining open for those who can't work remotely. Are you considering doing that here?
Not at this time. Our daycare and childcare centers are vital to allowing people to stay in the workforce, especially a lot of our healthcare professionals. We've heard a lot of requests from parents and from the workforce saying, please, this is if these facilities were to close, where they're going to either be held back or they're not going to be able essentially to go to work. And we know that those are not large schools, right? They're daycare centers, they're smaller in size, they're more manageable in size. Sometimes they use shifts. A lot of them are using pre-screening tools now as the kids come in. So we feel very confident that we're doing everything we can do to ensure that that population is safe, that they're not going to be a transmitting population. But again, workforce is going to be critical as we move forward here, especially in the healthcare sector, and we want to make sure that's as vibrant as possible.
Did you say that there's a $50 million fund to
So-
the health providers?
Today I've created a $50 million fund to help hospitals.
50.
I'm sorry?
50.
50.
Okay.
That's right.
And just where is that money coming from?
The general fund. Okay. Well, thank you all very much. Again, we'll keep people updated on both the bigger decisions and the opportunities as they come forward. Thank you.
Thank you.